Hello, my name is Daniel McIntosh, nurse practitioner student at West Texas A&M University. Today I will be demonstrating a simple interrupted suture. Our patient today is a 28-year-old male who cut the back of his left forearm while cleaning a kitchen knife. It slipped and he cut himself. The knife was already clean, so it doesn't appear to be a dirty wound. And so with that, we'd be ready to begin. So our first step would just be basic cleaning. So we would begin by washing our hands very thoroughly. Um, and then we would come in and then ideally would have pressure cleaning with possibly saline or just plain water and either a syringe or with a bottle that you can squeeze. So we just want pressure is the important thing to get any possible debris out, get it as clean as possible. Then we'd want to prepare our sterile field. I just have my homemade version. So this would be our windowed sterile drape, and then we have our other sterile drape for our tools. Let's see. We would have a syringe and needle, which I don't actually have with me, but we'll just imagine that we're opening a syringe, and a 27 gauge needle would be good for the back of the arm. Our lidocaine can be 1% with or without epinephrine for the back of the arm. Then we would open our tools using sterile technique of package opening onto our field. And our suture, I already have a suture open, so I'm just going to use that one. In this case, for the back of the arm, we can use 4-0 nylon, which is what I've got today. I'd have all my tools on the field, and then my sterile gloves. Have betadine ready to go. And with that, or some other cleaning solution, and with that, I think we're ready to begin, or to get sterile. Sterile gloves I could pick up by the cuff. First one on. Into the cuff of the second one, so that the outside of the sterile glove is the only thing touching the outside of the other sterile glove. Alright, with that, we're ready to begin cleaning with betadine. Clean really thoroughly. Okay, all clean. And now we'd be ready to begin infiltrating with lidocaine. So I would attach the needle to the syringe, have someone invert the bottle, or I could do it myself, if not touching anything, of course. Fill up the whole syringe, even though I only use a couple of mils probably. And then we'd be ready to start. So with this laceration, if it was deep enough, we could infiltrate into the edges of the wound itself, or we could infiltrate externally. Either way, you go in at 45 degrees, gently infiltrate, and you have to do on a longer incision multiple sites of infiltration. But then once you've got it adequately infiltrated, you would just verify by gently touching with the needle and making sure the patient isn't feeling any pain, possibly only pressure, but they shouldn't be feeling any pain before you begin suturing. And once they do not feel any pain, you're ready to begin. So I have my needle drivers, and I have my suture. So I'll want to attach about 2/3 of the way along the way. Oop, wrong way. Alright, so I've got my suture where I want it. And so we could start right at the middle of the laceration. A lot of times that's good for just getting good closure. It really depends a lot on the laceration. If one side has a lot more tissue stability, you might start there, but starting at the middle is often good. So we, not pinching the tissue, but just lifting it, we would slightly evert the first wound edge, and then we would make our first bite at 90 degrees with the suture, with the needle rather. You could do a 1 bite or 2 bite technique. With this one, I think a 1 bite technique would suffice, where we just go straight through and get both bites in one sweep. And we're through. I'm going to pull that all the way through, leave just a couple centimeters on the end. Make sure when you drop the suture, it stays on your sterile field. And then we're ready to make the first knot. So I've got my short end away from me, so I'm going to do 2 throws for the first knot, grab my short end and pull it towards me, get good closure there. The rest of them will just be 1 throw and alternating each time, either towards or away. And we'll keep doing this for a total of up to 6 knots maybe. Just depends on how strong you think the knot needs to be. And so once you've got enough knots to make sure that your suture is good and strong, you're going to pull it off to the side a little bit so that you make sure that the knot is not going to irritate the skin. And for the sake of time, I won't demonstrate the entire suture, but for a simple interrupted suture, you would just do each of those, down the line, half centimeter or so apart, until your suture is entirely closed. And then, so as far as educating the patient, you'd have to educate them on signs of infection. Since it is a clean wound, it does not need prophylactic antibiotics, but it would be good to have follow-up in 48 hours to verify that there's no signs of infection. You would also want to teach the patient about signs of infection, such as spreading redness, drainage, warmth, increasing pain. And since it's a nylon suture, it will need to be removed. On an extremity, you'd want it to be 10 to 14 days. So just tell the patient that they would have to come back to have it removed in 10 to 14 days. And otherwise, that they can clean it very gently with soap and water, and see them in a couple days for a wound check. Thank you.